I'm Sara Kurki. I'm the lead hospitalist here at Kirkland District Hospital. I do ER, but mostly hospitalist. I also cover OR assist. The hospital itself is about a 40 to 60 bed unit. We don't normally get up to 40, we're just normally under that. We also have one general surgeon, Dr. Bisbal, and we have a GPA, so an anesthetist. We do procedures, we do bowel procedures, we do all of our scopes here, colonoscopies, gastroscopies. We also have visiting specialists that use our OR, so we have dental days. We also have a gynecologist that visits as well, so we do those surgical procedures. We have a urologist that visits and scopes as well. So we have a wide variety of visiting specialists that do support the community. We have a 4-bed ICU and a 2-bed step-down unit. The 4-bed ICU and 2-bed step-down unit are completely run by the family docs that make up the hospitalist program. We have 2 family docs on at all times for hospitalists, and they rotate by week. So we do 1 week at a time, or some people like to do more than 1 week at a time, and maybe it's 2 or 3 depending on how busy it is in their schedule. The hospitalist service covers the ICU. We do have visiting internists that we can get consults for, but they don't actually do actual ward consults unless you call them, and they might not be here at the time. So we have a virtual critical care service that's run from Sudbury. It could be a doc that's on camera from Toronto or another place, but it's run out of Sudbury. A lot of other communities in the north have this, but it allows us to keep our critical care patients in their home if we can support them. So we can use a ventilator, we can keep them vented for a couple days here if they're stable and they just need some more time, so decreasing, transferring them out and possibly making them worse. We have excellent respiratory therapy support. We have 2 respiratory therapists here who help us out all the time with any BiPAPs or vents that we have. Because we're family docs and we cover the ICU, the large majority of us are trained in central lines and arterial lines. And it just depends, what's going on at the hospital. Those things would be open to residents who would want to come here too to learn some procedures. Most of the family docs all do paracentesis, thoracentesis, central lines, arterial lines, and intubations because we are sort of a community, approximately 10,000. We cover an area of about 10,000 and other areas. We also take patients from Englehart Hospital that would be acute and need an ICU because they don't have an ICU there. So there's a lot of opportunity to get those skills here if we have those patients at the time, but there is a lot of opportunity. We have a satellite oncology clinic, so the hospitalists are responsible for seeing those patients if there are any issues when they go to oncology. It's run out of Sudbury. We do chemotherapy. We also do Remicade infusions and things like that, so the hospitalists will cover that. We have a satellite nephrology service that provides hemodialysis that also runs during the week. We don't necessarily go and consult on those patients, but if there's an issue, they go to the ER and we see them there. We do admit patients that say lived in Englehart but were sick and had to have their dialysis while they were sick, and they would also be under our care as a hospitalist. We see a very wide variety of patients in our hospitalist service. If there is a pediatric patient that needs to be admitted, we don't have a pediatric floor, we just admit them. If they were really sick, they would be transferred to Timmins, of course. We would see patients that would be waiting for a nursing home, which a lot of other hospitals deal with too, or alternate level of care patients. And then we have our acute patients from med-surg to the ICU critical care patients. We have 3 apartments for learners that are in the community with a total of 6 beds. I hear they're very nice. They are not within walking distance if you wanted to get into the hospital quickly, but you definitely could walk. I would recommend that a resident have a car to get around the town just because it's much easier. It certainly wouldn't be mandatory, but it would be much easier to get around. In summary, we would love to have residents here from the University of Toronto to have a great experience. We think we have lots of opportunity. We have a wide variety of medical options for them, from clinic to our inpatient hospitalist unit to the emergency room, and then any of our sort of specialty programs they can be part of as well.